So we look at the next concept in obstetrics, which is what is known as task shifting. So what does task shifting means in obstetrics? Of course, just looking at the word task shifting, I'll get to know that task shifting is more of like, you are doing things at a particular time, or different people are involved in getting a particular task into what completion. So all of them have different roles to play. You understand? So, but in obstetrics or gynecology, it's just a strategic approach to redistribute clinical responsibilities, okay, from highly specialized providers like obstetricians, okay, to the roles that other health workers need to play, okay, in the well-being of a pregnant woman. So other health workers could include people like the midwives, the nurses, the community health workers. All right, this is because you want to expand the access, reduce the workload on the specialized consultants in gynecology and obstetrics. So you want to improve maternal outcomes. Of course, the specialists for all this gynecology and obstetrics, most of them in a day they have to visit many hospitals. Do you understand? So they need all these nurses, midwives, community health workers to be able to report some things to them. So how is this task being divided between these different set of workers? It involves delegating specific tasks, things like administering some drugs, assisted deliveries, okay, managing bleeding of women after they give birth, okay, to people that are not really specialized in obstetrics and gynecology, but at least they have been trained or given the orientation for that. Also known as task sharing, is endorsed by the World Health Organization. This is because hospital workers, some of them they go on night shift, morning shift. So if you shift these tasks, it makes the whole system to be able to work. Do you understand? It's not one people. You are not overworking a particular set of people, but you are sharing what the work. All right. So examples of task shifting is what things like administering what drugs to handle postpartum hemorrhage. You can shift it to what community health workers. Okay. Manual removal of placenta, midwives can do it. Cesarean section, so non-physician clinicians can do it. Okay, it's a very simple surgery. Okay, once they are oriented. Okay, initially surgeons that are supposed to do it. Okay, neonatal resuscitation, that one, the baby is what dehydrated, so you need to give fluids. All right, the lack blood, you need to transfuse. All those things. Okay, community health workers can do it, or trained birth attendants can do it. Antenatal counseling and screening, of course, nurses that have been in the field for a very long time can be able to advise pregnant women based on experience or special trainings that they have received. So impacts and benefits is improved access to emergency care. So even if a pregnant woman comes in and the specialized obstetrician is not there, okay, at least she can receive one or two care. You understand? There's reduced death of pregnant women, alleviate workforce shortages. Okay, so it has to divide the whole tension, so the hospital facility is able to attend to people. Enhance efficiency. All right, so challenges and consideration is this: training and supervision must be robust, in as much as these other subcategories of healthcare workers are doing this. They must be overseen by a specialized obstetrician, okay, whom they are reporting to, who is auditing them, and who is making sure that everything is going on as planned. All right. Professional resistance from higher level cadres may hinder implementation. Okay. Legal and regulatory frameworks must support expanded scopes of practice. Monitoring and evaluation are needed. Okay, just for you to make sure that the outcomes are nice and all of that. Okay, so this is just what this task shifting concept means.